So I will be talking today about Zika viral infection for the next 40 slides and 40 minutes. So you find a lot of children. This is the most dangerous thing. You are going to have somebody getting infected. A pregnant lady can have a disabled child. So now we are listening for the last 2 years. We are overloaded with viral issues, emerging viral infections, a great threat to everyone. It is unlike previously, most of these infections are located in some tropical Africa and all because of this fast travel and also the climatic changes. No one is safe in the world unless you have some controls. History of the Zika virus is very interesting. First isolated in 1947 from Uganda. And because it is isolated from a forest of Uganda, it is called as the Zika forest. That's why it is called as the Zika virus. Near Lake Victoria, by the scientists of yellow fever research, there were so many deaths with that yellow fever. They were doing a research and they got it, a new virus. They thought named it as the Zika virus because it is parented in that area. The second isolation from the mosquito Africanus, that we are not much aware of it. There is a mosquito peculiar to some Uganda, Tanzania and all. And it is also isolated in 1948 when the monkey developed a fever, research isolated from serum. So this all goes on this thing, and the research is not in much progress because there are a lot of political events happened in Uganda. So the research is not much conveyed to the world. You know, the events with the Idi Amin and all these things. So international organizations were not there sometime. So zoonosis is becoming now, coming back to this one, we are all living with the help of the nature. Nature does not mean some ocean or a sea. It is all the surroundings and the animals you have it around you. There was an incident we have visited once, Kadapa in district, when there was an encephalitis cases. The people were keeping that some of the domestic buffalo and all in the front of the house where they are staying. There were some mosquitoes and there were some vectors, and it was being diagnosed at the National Institute of this one. So we are all connected with what we are around. The recent outbreaks are all this thing, and the Ebola was there, and there were always some incidences of Ebola coming. And the next is coming as the Zika virus. Next is, before 2015, India was not much having the awareness about the Zika virus. But you see the map after 2015, even we are all not safe, and there are, but the reasons being we doesn't have proper kits and awareness. So now it is developing after this Kerala incidents. Now there is also a new virus entering into India, and that you should be very aware of it. What is this Zika virus? Belongs to flaviviridae. We all read when we are medical students. All these are all flaviviridae. This thing, dengue, yellow fever. Flame means it is just like a flame. It appears like a flame. That's why they are called as the flaviviridae. So like you see a lamp or a flame. Like other Zika virus is enveloped, icosahedral, and has a non-segmented, single-stranded positive sense RNA. Infection is an arboviral infection. So it means there is a vector in between us and the nature where this virus are. There is a member of the flavivirus. As I already told you, the most important mosquito which is in India is the Aedes aegypti. If you ask me a question, why this virus are coming at this thing? This is the stage where if you find a rain which is very fresh, you have a water and the stagnation of a fresh water. Aedes aegypti is a clean water mosquito. That means it will breed only in these things. Basic biology of the virus contribute to the disease because this allows virus to adapt quickly to the adverse environment such as the human immune system or the drugs. So that means you say that it won't take a very long time to produce some symptoms. Suppose it's not like a slow virus. It adapts very fast to the humans. So it is immune system gives a way for this virus very fast. Lineages, there are two lineages. One is African lineage and another is the Asian lineage. I think India needs a lot of research to go into that one to find out which lineage is there. Suppose these are all important from where it has spread. Suppose if you are getting a African lineage, that means somebody traveled in Africa and he got infected there. And there can be some things, Asian lineage means that the people living in Asia, they can more get adopted. Should I be worried? This is the great question. That means so many asked me one question in the chat. There is a lot of cases of Zika. I should be worried. Anyone, my answer is very simple. Anyone can get Zika if they have not been infected before. We are not having any immunity if you do a good searching, unless you worked in Africa or somewhere, the area where most people infected with the Zika do not have any symptoms. So they might not even know they have the virus. That is an infection. Zika is of greatest concern to a pregnant woman developing a baby. Zika can cause birth defects if a pregnant woman becomes infected. So in this process, suppose there is a Zika virus in Karnataka or a Tamil Nadu or anything, who are the most important people to be concerned with this infection is the pregnant woman. Suppose if they get infected very early in the pregnancy, what happens is there will be birth defect. That is the most important point, is the brain do not develop and that woman can have a very disabled child. This is the most mentally retarded, even no IQ-like situation. It's important to see, there were some cases in Brazil and all these things. So there were some incidences in 2015. So there were some events, I exactly cannot this one, because they all said that people should avoid the pregnancy in the next few months. That may be possible, may not be possible, but already those who are conceived had a lot of cases. Basic facts, the incubation period of the virus is estimated to be just very short, just like a cold, and it is just mild symptoms. Most people with Zika virus infection do not develop symptoms. It is the same mosquito species. This is the greatest concern now. Dengue, chikungunya, and yellow fever. If you take, I worked about 11 years in Kerala. Most important thing which starts immediately after the rains is the dengue fever and chikungunya. And there are incidences. Dengue is very well controlled now. There are so many this thing, and although there are so many mishaps also happened with the dengue. They are doing an improper test and giving the platelet transfusions. Kerala had a lot of shortage of platelets and blood when the people are giving erratically the platelet and blood transfusions. Chikungunya looks very distinct, but it is very distinct. A person traveling to a distance of by overnight is okay in the evening, but the time he gets down from the train in the next day morning, he cannot get up from his own berth, and he has to be carried in a stretcher to this one. Just see, anyhow, we are lucky we doesn't have any yellow fever. Only we need vaccination when you go to some of these areas where there is an yellow fever. For the majority of the people, infection is not a serious issue, but can be very dangerous among the pregnant. So I want to tell, suppose somebody may ask you, everyone should be screened. It is not possible, and it is only very difficult also. There are not many standardized kits are also not available. How the Zika virus spreads is mostly by the bite of infected Aedes mosquito or Ablepticus. These mosquitoes are biting. See, I find this is the Zika can be passed from a pregnant woman to her fetus during the pregnancy. Yet there is no vaccine, there is no medicine for Zika. This is a very important. This is what happened with the COVID also. We experimented with a lot of antiviral drugs. We are also seeing some consequences. Suppose somebody has got a suggested, there's no this one. First you find a part of it and all, and see, in Delhi, there was a lot of cases of dengue. When they went into the only domestic collection of the water, clean water, people started storing the water because the water supply is erratic 2 to 3 days. That caused the very much epidemic of dengue. The same thing will happen. This is the cycle. If you take a small bucket, you put it in the house, and you take it is there, the whole cycle will go on in this one. This is the Aedes aegypti. Unless you protect yourself from mosquito bites, you cannot this thing. And the same mosquito, all of you are very aware of it, lay eggs in the household or backyard containers. So you should not have a container or a small potholes, aggressive. Because the most important thing is that suppose some mosquito is biting you in the daytime, it is most dangerous to get all these diseases, except that yellow fever in India. See, spread of virus can migrate between the humans through sexual contact. It can also cross placenta, affecting an unborn. Another already infected Zika virus near time delivery can pass on the virus to a newborn around the time of the birth. Because we do not have much knowledge about, even in Africa also, there are not much research is there on this one. What happens to a newborn child if a mother is carrying, and this one, infection will be carried by the blood and all these things. But intravaginal damage and all these things during this one, the child can get infected. It needs a lot of research whether the child got infected as a fetus or through the time of the birth and all. We are all read and all to the HIV infections. So this is just a life cycle and all these things. So above all these things, the most important thing is a pregnant woman, where the mother to baby and also the sexual activity. And also Zika virus, suppose somebody has given a question, Zika virus is transmitted, is also a sexually transmitted disease. A husband is having a Zika virus, he may not have any symptoms, but it can this one. How Zika is spread? Zika can spread through mosquito bites from a pregnant woman to her fetus, sex with an infected person, laboratory exposure. We are doing experiment. This is a very important. You should work in that biosafety grade 3 cabinets. Otherwise, you can get maybe spread through the blood transfusion also. This is also another great issue. But to see, we are go on adding the things to screening the blood. We had HCV, HBS, AG, and also HIV. So a day may come, a pregnant woman delivering needs a blood, or during the pregnancy, they should also screen the people. That is not at there. Nothing, nobody has warranted. It is the ICMR and WHO take the decision. Because see, the public health concern is there. They will not take into individual character. They will take into epidemiological this thing. Suppose they will calculate for the how many thousands of the people pregnancies, how many got affected, and what to be done. And all. This is another picture where how does Zika affect people? Many people with Zika will not have symptoms or will only have mild symptoms. Symptoms last for several days to a week. People usually do not get sick enough to go to hospital. This is also very important. See, most of the viral infections just presented, not like this, I do not say about polio or anything. Most of the viral infections carry the same symptoms as these things. Suppose I was unwell, we cannot say it is a cold, whether it is an influenza, whether it is a Zika virus or a Hunter virus. This is the problem with the viral infections, because people will just take rest and get well soon and nothing will happen. What are the symptoms? For people with symptoms, the most is the fever, rash, headache, joint pain, conjunctivitis, muscle pain. If you take 99% of the infections or any fever or any drug reactions, carry all these symptoms. So we cannot say. This is a very interesting picture. UNICEF has produced headache, slight fever, conjunctivitis, rash, muscle and joint pain. If you take chikungunya, it looks the same thing. If you add to this one joint pains, dengue also will be there. And all everyone, see, these are all the things which a classical description for teaching nurses and medical students. When it comes to the reality, nobody will come near to you with any. Zika viral infection during pregnancy can cause infants to be born with microcephaly and other congenital malformations known as the congenital Zika syndrome. Infection with the Zika virus is also associated with other complications, including the preterm birth and miscarriage. This is very important also, because nature sometimes a disabled child is miscarried. Suppose a child is having a lot of genetic disorders and all, they get aborted. But the one thing is that if you take a normal pregnancy and an abnormal fetus like this one, nature has its own way. Sometimes the people will abort because the child cannot adjust to the circumstances with the growth, lesser growth of the vital organs and particularly brain is the needs the least investment in the fetus, but only when it's born it needs more great. A greater threat with the involvement of the CNS. This is a very important, I think many of the medical colleagues seen. I was working in Madras in Apollo Hospital in 1993. We had many cases of Guillain-Barré syndrome. This one very coming and all these things was coming. So a lot of, even you please go to your medical textbooks, we get a diarrhea very often or a dysentery, but we don't do any diagnosis. We take some antibiotic or a anti-amoebic drug. But there is one bacteria called as the Campylobacter jejuni infections. They are known to cause, suppose somebody has developed a neurological involvement, a paralysis or an inability to this thing and all. After a course of diarrhea, please take it. That is one of the most important Guillain-Barré syndrome is there. And also, the syndrome is also associated with some vaccinations also. There was a question, the people who are not developing immunity to the hepatitis B, you give 3 doses and they do a testing of the antibodies. They have got less than 10 international units. So you go on giving 5th dose, 6th dose and all these hepatitis B vaccines. People can manifest as a Guillain-Barré syndrome. So there is some, this is a very important nurse and all these things. See, it is been said, it is an autoimmune reaction. That means mechanisms and all are very complex. There are so many diseases which are autoimmune, involved with the neurological system. Zika is one thing which causes this thing. It is actually been first proposed in 2014 in French Polynesia with the World Health Organization reporting explosive spread of Zika virus. There are concerns that Guillain-Barré syndrome levels may also increase. So it is not that India getting and all these things. There are so many French colonies in this thing. Suppose if you take to Jair, it is a French colony. If you go to Zambia, it is an English colony. If you go to Uganda, English colony. So these are all the people, migration, thick jungles, and these mosquitoes. And also, please remember, whenever see this Zika virus infections are there. Once the Aedes aegypti mosquito cycle is reduced, there is no rain for a long time, then definitely the mosquito will not survive. The cases will not. You cannot diagnose a Zika virus in a hot summer where there is no chance of a mosquito, this thing. So now what is most important, suppose COVID also, there were so many opinions about COVID. What they said is there that and all these things, so many people, I don't want to go into political issues. The COVID when handled by the epidemiologists and the community medicine people, and there will be less number of cases. This is what is important. Now every disease, please remember, virus diseases to diagnose is very difficult. Viral diseases are very difficult to control. Viral infections are very difficult to prevent unless you this thing. Suppose you look at COVID, only mask was the lifesaver. And if you take to Zika virus, it is only the prevention of the mosquito bites is the only thing and all. This is where the epidemiologist and community medicine's role would have been immense. It is not that microbiologist or a super specialist will educate the people. Every disease we have to make a module how to prevent it, because people will be, and people for the beginning, they will live in fear. Afterwards, they don't care for anything. That's what has happened with the COVID in the first and second wave. Because whenever there is a breakdown of an infection, there is certainly the environment is more important, particularly the virus infections. There is a global changes. Everything is changing now. Western countries are facing the threat of floods. Sometime back, heat strokes. It is never heard in the West. We all imagine that Western countries are the very much safe place, very comfortable. It is no more so. It is all, now everything is been devastating now. Guillain-Barré syndrome, the exact cause of it is still unclear. Generally develops after a lung or a gut infection appears as autoimmune. This means that symptoms caused by our own immune system attacking our own body. Please take into this one. This is a great part of the medicine which is entered. Autoimmune diseases is all becoming, see, if you take, there are two schools of thought. Hepatitis B infection, who will survive, who will die early was a great question sometime back, about 20 years back. Those who have got a strong immunity to fight hepatitis B, They all developed acute infections and they died faster and complications. That was autoimmune. If the immune system is very silent, this event will go away. The person can become a carrier or spread the infection as in hepatitis B. If the immune system is so strong, sometimes you find a very weak people survive and the strong people die. This is because of, this is a new phenomena is entering in medicine and the infectious disease is there. That means you're too strong to protect the infection. You find a strong man died, weak man survives. This is the one of the reasons that Guillain-Barré is there. Suppose you say he's a boxer, he's never thought that he will develop this disease and he will die. A weak person with a malnutrition and so many things not dying. This is also a phenomenon entering into Guillain-Barré syndrome. Yet I not read anything about a Guillain-Barré syndrome in this one. So the initial infection caused by either congenital Zika syndrome, distinct pattern of the birth defects in the fetus and infants in pregnancy, associated with the 5 types of birth defects not seen or rarely seen with other infections during pregnancy. Severe microcephaly, small head size resulting in partially collapsed skull, decreased brain tissue with brain damage to the back of the eye with a specific pattern of scarring and increased pigment, limited range of joint motion, such as the club foot, too much muscle tone, restricting body movement soon after the birth. This is the very important thing to the people and all. We have no idea about all these documentations from these things. These are all done in Brazil and some countries where they're known and all these things. So it is totally a disabled child will be born, and you find a lot of the internet also. You say the child is totally senseless to the world because it's a microcephaly and there is no development of the brain. About sexual transmission, Zika can be passed through the sex from a person who are his partner. Sex includes vaginal, anal, oral, and sharing of sex toys. Zika can be passed through the sex before symptoms start, during and after symptoms end. It can be passed even if the infected person does not have symptoms at the time of and never develops symptoms. Zika virus may stay in semen longer than vaginal fluids, urine and blood. This is also very important when you are storing the semen and all for future purposes. So this may become an SCT if it becomes and all these things, this artificial and IVF and all these things. Who should be tested? This is a great important question. Recently, they have given some few kits to Trivandrum Medical College and in Kerala. And you cannot do for a Zika test for all these things. Actually, there is no fully established diagnostic test because they are all doing on some. I will come back to that one. Pregnant women, who should be tested? Suppose somebody calls you tomorrow from Kerala that they say who should be tested. There is a Zika virus. Pregnant women who live in or frequent travel to areas with risk of Zika. Suppose traveling to Kerala, you go to a place, Trivandrum and all these things. Not now at this thing, but suppose if you are traveling to some African, pregnant women who have fetus with a prenatal ultrasound find is consistent with the congenital this thing. So now what they are going to do is they will do a scanning and all these things because non-invasive procedures are more essential than this one. Live in or the travel to any area with a risk on head. Unprotected sex with a partner who lives or travel to any area with a risk of Zika. Suppose somebody goes from India and has a sex in Africa with someone and all these things cannot. The vice versa also can happen. And because now the life is universal and global traveling is one of the great contributed to this one. Testing babies. CDC recommends laboratory testing for all infants born to mothers with the laboratory evidence of Zika virus infection during pregnancy. Infants who have abnormal clinical or neurological findings suggest of congenital Zika syndrome and a mother with a possible exposure to this one. So immediately, suppose a good progress is not there in Africa and all, the mother may go to a hospital that I had a Zika infection, my son, can I have a test? But by the most of the damage which is done is during the pregnancy only. There is nothing left for usually the baby getting some damage out of this thing after birth is very less neurological, but it goes and as a normal infection. What tests we should do confirm? The most commonly and widely used diagnostic technique is based on the virus molecular detected by real-time or protocols taken this thing. There are also yet we doesn't have any standard guidelines, because unless we do at least some few hundreds or thousand cases, we cannot give how much it is false positive, how much it is false negative. I'll also come back to that one, whether the test we have done is actually the patient may have a dengue fever, but the reaction can be read as a Zika, the direct facility. So what is most important is the triplex kits that they are given to Kerala, about 500 triplex kits. And this is the only thing I think approved by the FDA to do the testing for this one. It is also not totally been acknowledged as a 100% or a 99% reality, but it is just in the process of testing, and we have to do hundreds of samples. Molecular basis, the viral genome detection by molecular techniques provides a definitive diagnosis, but as a viremia is transmitted, the approach is most reliable within the first week. Suppose this is also a great problem. Suppose a woman gets infected first trimester. The test you do it, you get negative. If suppose she is infected about 1 month back and you do after 1 month, the test will be negative. And this becomes a most important. The utility of the test is reduced because of this viral genome has got one advantage and disadvantage. It will be usually progressive when the virus are actively multiplying. Once that trace of the antigen will disappear and the antibodies will be this thing, yet we don't have a good specific and a sensitive serological test. Even if you test a woman, it may come as a Zika test for negative, but the child may get infected unknowingly. This is a great important. This is a point I stressed it, that within 1 week of getting an infection only you can do it. Most of the molecular tests are very active and in the active stage of the disease, because once the antigen reacts with the immune system, they will either the antigen will be most of the times reduced with the death of the virus. So we have to do a quantitative method and all these things. They are all doing experimental. Such projects are going on in Africa, where that viral load and all these things. This becomes how much severe. Suppose a lady with a Zika infection want to carry with the infection. That what is the safe levels of it? That is done in many cases, but it is not yet been much progress in doing the things in Zika. So other specimens can detect Zika. Although Zika genome has been detected on amniotic fluid, cord blood, CSF, placenta, RT-PCR method sensitive. This is a very important also, because the other specimens also may contain this one. Suppose if you want, if a pregnant lady is there, her blood, you do it, and at the same time, if you are doing a cord blood and you aspirate amniotic fluid, and you can do it, the child is floating with the Zika virus around it. This is a very important thing. Mother's test, how far it is positive. These are all the tests which are, unless we have these publications from because, and also I think the Western countries may not take much importance, because this is more confined to the African continent. So it needs a lot of funding, and some dedicated people have to work, and they have to report from the place of the work under the control. This is the Zika is facing this one now. Suddenly we flared up with the Zika. We are opening eyes to this infection, but the research facilities in Africa are very, very difficult to assess the cross random and studies on the people. At the most, we can do a random studies, not many things. So other serological, some people may come tomorrow to you that we have got a wonderful kit that the anti-Zika, IgM, IgG can be detected. But one problem is there. You have to do how much is sensitive and specific. I think all my friends know. It may be sensitive. That means even if you have other flavivirus, the test may become positive. That we may think that it is a Zika virus, but it is not specific. So if you go into the terms of the microbiology, sensitive means it is caused with corresponding flavivirus and all, it will become positive. Suppose you are doing a test with the antibodies for a dengue virus, patient may be having a Zika virus, you may get a false positive. This is a very big issue. The test is sensitive, but not specific. because there are three parameters which may cross-react with this one and make the test less sensitive. IgM detection distance, this is also now, I think if India purports a great number of cases, we will have somebody may come out with the IgM testing, and it is usually possible in 5 days. As you all know, dengue virus, we are doing the IgM testing. By 13th or 14th day, dengue virus infection become positive. They made some studies with available literature. This thing they say that IgM start producing by this one. Errors in serology. Seroconversion represented by at least the increased paired sera, acute, this one reliable. And I just want to mention one thing. No test in any infectious disease comes negative in the first reporting. It is not at all significance of a negative. You also have to do the paired sample. Today, the patient must have got infected. You do a test after 3 to 4 days, the test may be negative. But you do it after 10 days or 15 days, the rise of the antibodies, particularly this is more to be considered in case of serology. You do a viral test. As you know, it is an obsolete test. Still, we do it. In the first week of typhoid, we never get a viral test positive. Only its significance starts from the second to third week, as it happens with any other infection. So, what I just want to convey the message to the young doctors is there. No first test is final. And you should think about doing the test. If you persist with the diagnosis, you have to do it second time. That is called as the paired sample. So you also know about, I will just enumerate. We had some legal cases. I was working in a corporate hospital. A patient has been done the coronary bypass and he is hepatitis B negative. And after blood transfusion, sometimes after 3 months, he will come back with the hepatitis B positive, and he want to have a compensation from the hospital because that he got infected in the hospital because of the wrong transfusion. These are all the errors because there are so many. See, I am also see most of the microbiologists, they do report, and a reporting is serology is the most difficult if you really happen to this one, because it is just a report does not mean anything. And if you get suppose you get lot of lab reports, you say that it is a first day it is positive, and first it is positive, then it is negative. Within 1 week, it cannot, IgM cannot, may take at least, you have to take into consideration of the half-life. So a traces will be there. This is a very complex situation. So no test is this thing. Clinical judgment is also very important. Now the other ultrasound and all coming into this one. Cross reaction, this is very important. Zika and dengue virus antibodies cross react, made it difficult to diagnose which virus caused the current illness. None of these probable cases are tested positive using molecular testing. This is a very important. Why thing is that now you had a rapid test for COVID, and ultimately everyone is a gold standard is RT-PCR. The same thing is happening with this one. And also, please remember, my young friends, so many laboratories are there. Tomorrow somebody may come with a rapid test or a screening test. They are all not at all to be taken into clinical consideration. It is only for surveillance. Suppose if you are doing a test and all, suppose you send to the district health headquarters hospital that dengue, they will ask first is, have you done the ELISA? Are you done a rapid test? Now everything is a rapid test. So just ignore if you are getting a rapid test. Tomorrow somebody may come out like a COVID, a rapid test. It is only surveillance. You see how many out of the 100 people, approximately 10% are affected, 20% are affected. Same thing will happen tomorrow to the Zika virus. Wait and watch. Do not start any antiviral treatments. This is very important. There is no as such as this thing. And now tomorrow they will say some drug is acting on the hepatitis B, and why not it will not act. That is caused a lot of, the COVID has caused a lot of mess up with the things, because I think we over-treated COVID than the reality check, and maybe this black fungus is also a fallout of using a corticosteroids, because whenever you are using multiple antibiotics, antiviral drugs and all these things, the body system gets shattered, and you may lose the natural immunity. This is what the WHO has recently written to all the people testing in India. Don't do anything. Just ultimately, it is the paracetamol for a fever. This treatment, there is no specific treatment, and think of it to help relieve symptoms. Get plenty of water. You see a nice picture that CDC has published. See one of the most important picture with this thing. The person should have a drinking water by the side of to prevent the dehydration. This is over time. So many medicines, acetaminophen, Tylenol in US and all they are using, but we are using a paracetamol. So if one is having a one or the say all viral infections they take. Suppose somebody has got a cold, you should not. There are people who say you least drink a lot of running up the nose. It is not a solution to stop drinking the water. If you take a lot of water, it itself gets diluted the things. Use of DEET. This is not, I have not found anything in India containing this one. It is only, I got it from the Amazon. In US, 1/3 of the population uses this DEET in prevention of mosquito bites. And everyone carries. That means in US, if they are carried, this is a very authentic research. There are so many viruses getting imported into US, West Nile fevers, because America is a country where the people from all corners of the world to patronize to their business and all these things. This is actually, Amazon was selling some time back, but it is not available. The things which they are selling in India, they are not having this thing. This is a very important question for the community health medicine also. DT, that is called diethyl methacrylate. That is this one. To conclude, our understanding of the pathophysiology of Zika infection needs to be strengthened, and epidemiological studies and the animal models of the disease need to be developed. Accurate, portable, and inexpensive kind. That is all the aim of everyone. That means the test should go to the patient, not that patient comes to the hospital. That means people are reluctant to get tested, people and all, unless we move out. That is one thing. See, now everything now it stands good with the COVID also. The public policies need to be implemented. Effective preventive measures such as vaccines to be an ideal dream. So our vision to future, accurate, portable, and inexpensive point of care tests. See, this is all being done in UK has developed a lot of point care tests. That is one of the countries which has really advanced. UK. They made a lot of things which are, they are able to control the diseases very promptly in UK and all some of the Western countries, because they invest more money on the point care test. Suppose a patient is there in the house, somebody health worker will go to the house and do the testing. That means you will never miss the things which are happening in the society. Emerging solutions. The recent outbreaks of Zika virus infection and the micron has resulted in unprecedented effort by researchers to target. And everybody is doing their own this thing, and certainly if hundreds of people get affected in many other countries, definitely the Western countries, definitely not only a science, but also the commercial aspects will also do. Vaccines in development, they are trying the vaccines. And along these linear lines, several vaccine candidates, including infected, they're all just, see, these are all experimental, but I just want to convey a message. To know the truth about any vaccine, it takes nearly about 5 to 10 years, because viral vaccines are really entirely different. It is not like that a typhoid vaccine and also antibodies are produced and neutralized, because most of these particular vaccines and all targeting RNA vaccines and all, they penetrate the cell and go into the cell, and the consequences of many of these vaccines, we don't know what type of chromosomal changes they make, particularly like Zika virus. There are two schools of thought. They don't want to do it on the human models. Some animal models they are trying, but I think we can find some success. So Kerala, this is the press trust of India is released. And today I just came to know in the news, it was there, a pregnant lady is infected in Trivandrum and tested positive. Also, a physician also tested positive. So this is the information. See, this is a Pradha Velu from Tamil Nadu. Testing for Zika limited to the authorized centers like Pune, or we can do further confirmation, we can send to Pune. I think in Kerala recently there was a NIV organization is there in Alappuzha in Kerala, and they are started doing for this one. And Pune is the center under the guidance of Pune only, NIV only. All these diseases, doctor, please know, any disease we cannot depend upon any private laboratory unless it is created by the NABL and all. Now the only authority in the country is National Institute of Virology. How is the diagnosis? Zika patients, as I told you, that the test which we have to do it is RT-PCR. There is no doubt about it. That triplex, that also detects 3 types of the diseases. And Dr. Mukherjee, please enlist all medical legally relevant laboratory-based investigations that can help us, primary care physicians, to clinch the diagnosis or what footing. So please enlist all medical legally relevant laboratory-based investigations. See, medical legal, I cannot this thing. Actually, microbiology, pathology doesn't have any medical legal content into the diagnosis. Only forensic medicine has got the laboratory relevance and its legal. Suppose the medical legal, it becomes a very complex and lot of issues. This thing I am too not aware much of it. Upajjaya, is there any relation with the coronavirus? Yet I do not know. This one is there. Still we have to this thing. They have to know today. See, there are so many new things are coming. Till yesterday, we never thought of tuberculosis. Many people said people are wearing masks. The incidence of tuberculosis has come down last year after the first wave. But today they are telling that the people with the COVID must be tested with the tuberculosis. This is what happens clearly because we have to do hundreds of corona tests. We have to do hundreds of Zika tests. Out of 100 corona tests, how many Zika virus are positive with this thing? And Dr. Rudresh, role of genetically modified mosquitoes in controlling the Zika spread. And they were trying that one, but they are all this one, they will lose this one, but all are, I mean, only the people from the vector centers, they can diagnose how many can be. This is a very big project, Dr. Rudresh. Very nice of you, genetically modified mosquitoes and all these things. It is very much difficult. Like you have phases. Suppose you take, I want to tell you, suppose if you take Ganges water, we think very much horrified. There are so many dead bodies are floating into that one. Suppose we all drink as a holy water from Ganges, but nothing happens because of the phages. Nature is controlling there and all. Such things should happen in this also genetically, because this is a very much, and see, I worked for some time in the ICMR at Calcutta, National NICED, where they make lot of phages and they will take cans and put it into the Ganges water, and they put the same phages which are there into this one to prevent cholera. Like that one is there, it is that phages will this thing. Such things happen, but genetically it is a very expensive thing to do it also genetically. Is there any relation with the coronavirus that I told you, mosquitoes I told? Is Zika virus seen in India? Yes, now we are reporting today, they say 28 cases are there in Kerala. But one thing is that Kerala is a very migrating population are there. See, you take to the people going to Gulf and people coming to from the Gulf to Kerala are highest in the country. You take all the people, particularly people are located in the West Africa, people are located in the Gulf region and all these things. Wherever there is a, see, this case is Hantan virus sometime back, Zika virus now. And all these diseases somehow are coming to the Kerala. And one thing is very certain, what has been adapted to the people in Africa, they may not adapt to our own immune system because it needs a lot of cycle of events to spread the infection. All these infections new infection may come as a flash and it will also die very this thing. Zika is seen in the India, as I answered. How to diagnose Campylobacter jejuni infection, stool culture? Yes, I want to tell you, this is Rashida, Maharashtra. Yes, I want to tell you. Campylobacter jejuni to diagnose in our laboratory is very difficult. One thing is there, it needs a controlled environment. See, NICD is the center where I worked. They will do a lot of work on the Helicobacter pylori and the Campylobacter jejuni. what are all the tests we do in our laboratory? They're all not very specific. They're only, they're not specific and all, but Campylobacter jejuni is one of the commonest cause of infection. Our laboratories are not, in aerobic cultures and all, it's very difficult to identify these Campylobacters. Campylobacter infections are very common, and I told you also this Campylobacter is one of the things. People may come with diarrhea and they may land up with the Guillain-Barré syndrome. There are a lot of cases are there, but we are not doing. I think this question I already out of my service for last 5 years from Kerala. Now I am working with the association with some African countries with the internet thing and LCVR. See that if you go, you just ask some professor in a medical college, how many Campylobacter jejuni you have diagnosed. If you talk truly, accept it is a national institute with a good funding, what the reports they are giving, they are certainly questionable, and it needs to check the system. Suppose you take a Campylobacter jejuni or Helicobacter pylori, it needs a lot of investment. Temperature controls, not much and all that. Gaseous exchanges, they are all very difficult. We just randomly treat with some gram-negative antibiotic. See, any diarrhea, I don't think anybody will go for a diarrhea unless he goes to a teaching hospital for this one. How many days into symptoms? What the best time to test for Zika? That I already told. You have to test the PCR within the 7 days. Otherwise, you have to go for very insensitive serological tests. And tomorrow, you may get also the dengue kit you are using, not a very good quality kit. If somebody may be having a Zika, but you may be misguided as a serology test or a rapid test or this thing may give positive and can create some confusion. Dr. Srinivasan, Uttar Pradesh, can Ostimolol will help for this thing. No, there is nothing. See, till the things are established, we have to follow the information from CDC, WHO, particularly developing countries, CDC information. All the COVID guidelines are in this one. Next comes the second line of this international peer-reviewed journals. You have to follow these journals. Suppose the WHO says, see, WHO has modified, suppose simple solution to this one, take some little water. That is what has become. Oh, we avoid a mosquito bite. They're only things. So suppose if you are using, I don't have any idea about that, doctor. Thank you. And can help this one. What are the serious complications? I told there is no serious complication to an infected person. It is certainly dangerous to a child who is going to be born to a pregnant woman. That is the disability. It can see once you have a disabled child, all the fortune of the parents is gone in US and all. Please enlist all medico-legally relevant laboratory-based investigations that can help us primary care physicians to clinch the diagnosis on war footing. See, medico-legally relevant means I cannot understand if they can elaborate me. See, we do only thing. Suppose I have to, as a postgraduate, worked in this one. Only medical legal test we do it in case of rape, where you are taking a sample from not only the spermatozoa, but also the gonococci you have to affect. That is the part of the syllabus of this one. Suppose somebody has raped a woman, he may be habitually doing the rapes or sexually infected and all. That is one of the tests. See, all this, and see, you take doctor, no test has got any medical legal relevance. Suppose HIV test has got medical legal relevance, definitely. Except HIV, medical legally relevant means it is the court. Why medical legally it is important is there. HIV is included in the human rights chapter of the Supreme Court. Suppose why I am telling you, if you have a HIV, somebody, a pregnant lady comes to you for a delivery and you do a HIV testing, then that if you refuse to do a treatment, you can be booked under the violation of the human rights. You take to this one, they do not want this legal complication. That means, have you ever seen anything? Suppose somebody has got a tuberculosis, some man married a tuberculosis woman, then he cannot claim that she is having a tuberculosis and I want to divorce. These are all the issues which are, we are too maybe Western countries may have that. I do not have any much idea about it. See, medical legal test, see about the laboratory reports, doctor, I want to tell you, NMC, this thing, they said all the reports are to be signed by the MB, medically qualified people. It has the limitations, it is good and bad of it. But please also remember that 90% of the tests are done by the, 99% tests are done by the technicians, and you are only supervising and regulating authority. So they don't want to this thing, medical legal issue into this one. And also I want to tell you, asked a very good question, medical legally. There were some people went for a public interest litigation that they complained against the doctors, and they said that anybody going to a hospital, they are putting them in the ICU, and it is caused a lot of suffering and all these things. Then what happened is that Supreme Court has referred to the Medical Council of India into the Ministry of Health. What are the regulations of a person getting admitted in a ICU? So doctors will never lose the opportunity. So this issue of medical legal, see, you also do, please do find doctor. You go to one lab, test will be positive, and you go to another lab and test will be negative. What it means is that it is important for you in patient care, but medical legally we cannot fight on all these things. It is an understanding between the clinician and the laboratory and the patient. Unless some grave issues arise, this medical legal issue will not come. I will not go further. Is there any relation with the coronavirus? That same thing is this thing. Okay. Role of genetically modified mosquitoes, that all will this thing and all.
So we are almost done with the questions.
Okay, nice,
Professor Rao, and it was wonderful having you on the show, and we thank all the delegates joining in today. Any closing remarks? Any thank you for the delegates?
I just want to tell one thing. I think so many doctors and laboratories. See, now I want to tell, I have been in profession for 45 years in India. I worked with the Tropical School of Medical Association in Zambia, and also, see, laboratory can only be a servant of a good physician. Laboratory is not for fishing the diagnosis. That is the most important. That is an important of an MBBS. Even if I give a wrong test, the clinician should interpret the test. That is one aspect of it. And also the laboratories, we have 450 medical colleges. See, now India, I have written an article, coronavirus is not the last virus. It is only the beginning of the new chapter in the infectious diseases. So it is up to the elders and to how to bring in the accountability. We have got a lot of medical colleges, just only 3 minutes I will talk. Through many, and they have to combine 2 to 3 medical colleges, and they should work on this one. See, these are all things. See, I want to tell you, doctor, even if somebody is infected with the Zika virus or anything, practically we cannot do anything. I am not a pessimist, but an optimist. But what I want to tell you, in front of us, for one case, hundreds of misuse of the antibiotics is happening. Unless the qualified medical microbiologists and the scientists in microbiology must be the most important people to regulate the things. Because tomorrow in the WhatsApp, somebody may say, remdesivir is also effective, Zika virus, and also there are so many people copied the internet messages and killed so many corona patients also. That should not happen, and use your own wisdom, and laboratory is just only to support your diagnosis. Because see, there are no symptoms difference between a dengue virus, chikungunya virus, or a Hantan virus or anything. All are same. And how to track with the things is the only thing. That is my good message to all of you. Thank you very much.